Good morning, everybody. First of all, let me thank Dr. Atul and the organizing team of the MAPICON who has invited me at this prestigious platform. And the the topic of my discussion is gum diseases and your health. Periodontium refers to the specialized tissue that surround and support the teeth and maintaining them in the maxillary and mandibular bone. And the component of the periodontium include gingiva, cementum, periodontal ligament, and the alveolar bone. And periodontal infections can serve as a source of various systemic diseases, and the area of research in periodontology that relates periodontal diseases to the systemic diseases is called as periodontal medicine. This is a normal gingiva which is firm, pink, stippled with a knife-edge margin and a pointed interdental papilla and with a normal physiological pigmentation. Next we come to the dental plaque. The dental plaque, this is the invisible layer which is formed in our mouth daily. Sometimes when we touch our teeth without brushing in the morning and we feel sticky layer in our mouth, that is a dental plaque, and it is made up of millions of bacteria and the proteins. 1 milligram of plaque contains 2 raised to power 10, 2 into 10 raised to power 8 bacteria, and there are 700 types of microorganisms present in the plaque. And when the plaque keeps on collecting on your teeth, that will lead to the inflammation of the gums, that is the gingivitis. Gingivitis, in the gingivitis there is a redness of gums, puffiness in the gums, bleeding. Patient may feel bleeding while brushing or while eating hard things like apple, and the pain may be there or may not be there. When the plaque keeps on collecting on your teeth, that will lead to formation of hard stony structure, that is the calculus. And calculus is the or the tartar, which you see normally in dark green like structure or brown structure on the teeth, and it is mostly present on the lingual surfaces of the lower anteriors because the salivary ducts are present near those teeth. And it is made up of calcium, magnesium, zinc, and other metals. And mainly the crystals are the octacalcium phosphate, brushite, hydroxyapatite, and magnesium bitlocite. And the calculus composition is the proteins, viruses, bacteria, environmental debris, food remnants, and the toxic heavy metals. And when the calculus keep on collecting on the teeth, and that will lead to the inflammation of the periodontium, that is called as the periodontitis. And in the periodontitis, we see red, swollen, painful gums, loose teeth. The patient may complain, the gums will start receding, or they may start separating from the gingiva. There will be the bad breath in the mouth, or the teeth will start shifting. And the patient main complaint is that my teeth are becoming loose, or the patient may complain that his teeth are coming out, they are flaring. So there will be the main complaint of the patient. And the best part of the disease is that is most of the time it is painless. So without pain, patient doesn't go to the dentist or for the consultation. And so without good periodontal health, you can't have good general health. Because periodontal infections can affect your respiratory system, they can affect your bones, they can lead to preterm low birth weight babies, they can lead to stroke, heart diseases, and the uncontrolled diabetes. So now we come to the periodontal medicine. The periodontal medicine is a rapidly emerging branch of the periodontology that focuses on the wealth of the new data, establishing a strong relationship between periodontal health and systemic health or disease. So there is a two-way relationship in which periodontal health of an individual has a powerful influence on the individual systemic health and the vice versa. So there are main 3 different mechanisms by which oral bacteria, they contribute to the non-oral diseases. that is a metastatic infection caused by translocation of bacteria, metastatic injury related to microbial toxins, and metastatic inflammation due to immune injury. And the goals of periodontal therapy is to prevent tooth loss and to restore normal oral health, form and function, and to maintain the systemic health also in the same way. And the main organ systems and conditions influenced by periodontal infection are cardiovascular and cerebrovascular system, that is atherosclerosis, coronary heart disease, angina, myocardial infarction, cerebrovascular accidents, anemia, endocrine system, that is diabetes mellitus, reproductive system leading to preterm low birth weight infants or preeclampsia, renal diseases, respiratory system, that is COPD, and the acute bacterial pneumonia. Rheumatology involving rheumatoid arthritis and ankylosing spondylitis, cognitive function disorders like the dementia and the Alzheimer's disease, cancers like colorectal, pancreatic and hepatocellular carcinoma. So, in this, as the periodontitis starts, there will be the inflammatory pathway starts in the mouth, and that low grade inflammation will become systemic and can affect the other systems, leading to the inflammatory conditions in the other systems of the body also, like causing heart diseases, neurological diseases, arthritis, SLE, diabetes, and the gastrointestinal diseases. Potential biological pathway between periodontal disease and the systemic diseases, that when the biofilm or the plaque starts collecting over the teeth, that will lead to the that will disseminate into the blood and can lead to the hepatic response, leading to the production of the acute phase proteins. So, this will lead to the production of the oxidized LDL accumulation and arterial plaque formation, leading to the MI and stroke, and this can also cause further complications. The main pathogenesis of the periodontal disease is that the tissue destruction in periodontal disease comes from imbalance between host protective and destructive mechanism induced by the periodontal infection. The periodontal infection lead to activation of neutrophils. They will migrate to the area of the infection, and there will be the induction of antibodies, leading to the release of the matrix metalloproteinases, which destroy extracellular matrix component of the gingiva and the PDL, leading to the destruction of connective tissue, and there will be the production of pro-inflammatory cytokines, leading to the resorption of the alveolar bone. Previously, it was thought that is accumulation of bacterial plaque is the cause of main destruction, but gram-negative microorganisms that present in the subgingival microflora are the main culprit. These are the various microbial complexes which are present in the subgingival plaque, that is the red complex bacteria, orange complex, purple complex, blue complex, green complex, and the orange associated. And among them, the red complex bacteria, they are the more harmful. They are the main culprits, that is the Porphyromonas gingivalis, Tannerella forsythia, Trachonium identicola, and the Aggregatibacter actinomycetum comitans. So, as unhealthy mouth is full of bacteria, and when these bacteria, they go to the various system and they affect them. That is in the cardiovascular disease, mainly P. gingivalis, Trachonium identicola, Tannerella forsythia, they all are found to be the main culprit for the cardiovascular disease. In case of colorectal carcinoma or oral carcinoma, P. gingivalis and F. nucleatum is found. In respiratory tract infection, P. gingivalis and C. pneumoniae, they are all found for causing the respiratory infections. Similarly, in the diabetes and in the case of Alzheimer's disease and the adverse pregnancy outcomes, all the bacteria, these are found to be the main causing the disease. Effect of periodontal disease on the cardiovascular diseases. As this periodontal infection starts, this will lead to the increase in the blood viscosity by the increase in the fibrinogen, increase in the white blood cell count, and increase von Willebrand factor, and this will cause a ischemic heart disease. And the mechanism by which these infections they contribute to atherosclerosis is there is a direct effect of infectious agent in the atheroма formation, or indirect or host mediated effects, then common genetic predisposition and common risk factor like the lifestyle. Then is the periodontal disease and the stroke. Presence of systemic infection before the stroke leading to the great ischemia and causing the main post-ischemic neurological effect. And stroke patients are found with the higher level of plasma fibrinogen and CRP than those without the infection. And these are the various studies for this disease. And then there is the periodontal disease and the diabetes mellitus. Periodontal disease is considered as a sixth complication of the diabetes, and diabetes increases the risk and severity of the periodontal disease, and these are the main complications of the diabetes, that is retinopathy, nephropathy, neuropathy, macrovascular disease, altered wound healing, and the periodontal disease. And mechanism by which the diabetes, it influences the periodontium is there is a change in the subgingival microbiota, GCF, glucose levels, periodontal vasculature, host response, and the collagen metabolism. And this is the proposed model that explains that there is a two-way relationship between the periodontitis and the diabetes. As periodontal disease, this causes a connective tissue destruction, and this starts the as pro-inflammatory cascade is there. And also in the diabetes, there is a production of the advanced glycated end products. So this also lead to the production of the degradative cascade, leading to the connective tissue degradation. Periodontitis increases the diabetes, and in the case of diabetes patients, the periodontal infection also increases. Then comes the periodontal disease and the pregnancy. The gram-negative bacteria, they play a major role in the low birth weight infants, and as their products, they are through the they transfer through the placenta, and then this is the proposed model for the adverse pregnancy outcomes. Periodontal infections leading as a mother with a poor oral hygiene, it is exposed to the periodontal pathogens and their products, and fetus is exposed, leading to the inflammation. This will lead to premature rupture of membranes, preeclampsia, intrauterine fetal growth restriction, and low birth weight babies. Then is the COPD. Periodontal disease and the COPD, it is also very has very close link, because neutrophil influx released to the oxidative and hydrolytic enzyme, leading to the tissue destruction. As we all know that lung infections are caused by bacteria, fungi, viruses, parasites, and microorganisms which infect the lower respiratory tract by inhaling infectious aerosols by the spread of infections from nearby contagious sites, and oral cavity and the saliva and the dental plaque with the patient, and in the patients with the periodontal disease seems to be source for pathogens to accumulate and spread to the lower airways, and mainly the several oral pathogens are involved for this. Then is the and this can lead to the pneumonia. Then the Alzheimer disease, in the patient in which the periodontal disease, it is found that the periodontal pathogens like the P. gingivalis and Treponema denticola are also, they are isolated from the short-term post-mortem Alzheimer disease human brains, so that it is suggested that these patients, these diseases, the patients, they are prone for it. Then the periodontitis and the cancer. In the colorectal carcinoma, which is the fourth leading cause of cancer death, and it is found that F. nucleatum and Clostridium difficile is found in the intestinal microbiota, and gram-negative anaerobic bacteria are also associated with this. And Campylobacter species, Fusobacterium leptotrichia are also identified in the patient with the tumors. So, effect of treatment of periodontitis on the systemic diseases. It is demonstrated that if the periodontitis patients are treated with SRP, that is scaling root planing, they will exhibit significant reduction in cardiovascular disease biomarkers, and also it is reported that if the mouth is disinfected, so there will be the decrease in the serum biomarker, and also preventive and treatment, if it is done for the periodontal infection, this will reduce the likelihood of preterm low birth weight infants. And if the patient is given chlorhexidine twice a day, it is found that incidence of pneumonia is also reduced. These are the few studies which show that even the use oral rinse of the 0.2% chlorhexidine rinse leads to 60% reduction in the pneumonia. So periodontal disease and the systemic health and the clinical practice. So basically periodontitis is a gram-negative infection resulting in severe inflammation and the potential intravascular dissemination of microorganisms and the products throughout the body. So it is a silent disease until the destruction results in acute symptom. And so many patients and many medical professionals do not recognize the potential infection that may exist within the oral cavity. So to prevent periodontal disease, brush your teeth twice a day in the right way, floss your teeth once daily, visit your dentist 6 monthly, avoid smoking and smokeless tobacco, and eat a balanced diet containing vitamin C, E, and A. So I conclude that periodontal disease may affect the host susceptibility to systemic diseases through subgingival biofilm, acting as a reservoir of gram-negative bacteria, transit bacteremia, release of microbial toxins, and as a reservoir of inflammatory mediators. And more research is needed. So to prevent, to treat periodontal disease as strategy to prevent or treat CVD, diabetes mellitus, preterm birth, and other adverse pregnancy outcomes, and also for the respiratory diseases. Thank you.